So I think we will start this webinar, and I just want to welcome you all and thank you presenters for being with us. We have three, well, in my mind, very interesting presentations coming today. I think I've heard them more or less, so I wanted to give some others opportunity to see them as well or hear them. So I think we have we're not going to be any minute more than 1 hour. So we're going to be kind of strict on the presentations. You have like 15 minutes. And then maybe if there are some burning questions before we go to the next presentations. And I actually know that Thordis, who is the first presenter, is not going to stay until the end of the webinar. So if you have questions for her, at least we can have them like right after her presentation. So Thordis, Roegn Jonsdottir, I'm not going to have the others do your pronunciation, but thank you for being with us. And you're going to tell us about, yeah, well, I think I just let you tell us what you're going to tell us about.
Yeah.
So the floor is yours.
Thank you, Steinunn. Thank you so much for inviting me. It's great to meet all of you. Do you see my screen? Perfect. Yeah, so like Steinunn said, my name is Thordis, or Thordis in Icelandic, and today I will tell you about my company that's called Rekovy and our first solution that's called Bati, which means recovery in English, and how it supports long-term recovery from addiction from discharge at the treatment centers to daily life. So I have a background in engineering, and I worked as a product manager at the leading global company called Psychic Health, and I led the development for digital therapeutics for pharmaceutical companies like Eli Lilly and Pfizer, as well as one of the largest insurance companies in the US called Elevance Health. And I also led the development of a prescription digital therapeutic for the German market for menopause. So, and my team members are August, which is my co-founder, and then Leifur, which is our developer. So addiction or substance use disorder is one of the most severe diseases there are in the world. Despite its severeness, there's limited access to treatment. So WHO estimates that 80% of individuals did not receive necessary treatment worldwide in 2021. And the relapse rates were also high. So 50% of those individuals who sought treatment in Iceland required readmission. And one of the reasons for these readmissions is limited follow-up care. So I'll never forget it when my young cousin left the treatment center with a single piece of paper that included his goals to support him in his recovery. And unfortunately, a few weeks later, he passed away only a couple of days before his 20th birthday. So I saw there was a need of improving follow-up care, and one of the things that I felt like I could do to support was develop Bati, which is recovery in your pocket. So the idea is that the app supports you when you leave the treatment center, and it sort of holds your hand when you're taking your first initial steps in society after being in the treatment center. So through the development process, we took interviews with all the key specialists there are in Iceland, and we met with over 300 patients in Iceland. And of course, we also read research papers of what other companies abroad have been proven to show effect on. And I cannot emphasize user testing enough, as that's one of the key things that I feel most proud of. I think one of the core thing that a lot of companies do is they start user testing in the beginning, and then user testing sort of gets left behind through the development phases due to limited resources or tight deadlines, etc. But I feel like we've really managed to sort of keep that user testing at our core. So we regularly go to the treatment centers. You can see our partners on the right. So it's the 3 main rehab centers in Iceland, and we go to them and we have a presentation for their patients and ask for feedback. So feedback is really crucial, as we think is it really the use of the product really stands and falls with making sure that it's very usable and easy for patients to use. So we're at this stage now where all of these partners do recommend that their patients download our application before they leave the treatment centers. So how does it work? In the beginning, people put in their individualized goals, and then we personalize the experience based off these goals. And we support individuals in having overview over their success. So one of the key things that we do differently that not a lot of other companies do, or actually we do not know of any other recovery app that has this daily routine or a daily planner. So what we did is we went to the treatment centers and asked, what are you guys doing right now that you think is crucial for individuals to get success in treatment? And one of the key things is the daily planner. So people actually put like a plus or a minus depending on if they've managed to complete their tasks. And staying in routine is important for all of us, but especially for individuals that are taking the first steps and leaving the treatment centers and need to stay in routine again when they get back home. So we digitalized this treatment planner and gamified it to make it more fun. And one of our users, he has ADHD, and he used to use Apple Calendar to help him stay in routine. And now he stopped using Apple Calendar and only uses our app because the app gives him a clap on the back when he completes his daily tasks. So he loves this feature. And we really prioritize making it easy and fast, so it would be quicker than putting it on a piece of paper. And then, of course, being able to send a reminder, which a paper cannot do, and then really make it as encouraging as possible. And you can see here on the top, you can see the circles. Like the goal is to get all of the circles green, and then make it easy to plan the next week. And one of the things that people do today is they are taught to compare on piece of papers between weeks and see the scores that they did last week and see what's going better this week, what's going worse, and what do I need to consider. But here we make it very visual and fun to compare between weeks and also have the possibility of comparing over time. There are many different solutions globally that, for example, use remote patient monitoring. So people have their smartwatch and they use AI algorithms to prevent relapse, etc. Then we also, of course, have the typical telehealth. They can have the breathalyzer to prove that they've stayed sober or prove that they've taken their medication. And one of the key things that has been proven to show an effect is CBT, or cognitive behavioral therapy. And in a lot of the consumer-based app, community is a big factor. And then contingency management is something that we've seen for many, many years to be proven successful. And one of the leading companies in this field are really mastering contingency management on a digital platform. So we really believe that Bati can increase access to treatment tools, especially in rural areas. And I think this is not only applicable for Iceland, this is applicable for the whole world, and to increase goals achieved by patient post-inpatient treatment, as well as enhancing continuum of care and treatment adherence. So one of the things, or one of the places where we really believe Bati can be more useful is where people put their digital discharge plan up in Bati before they graduate. So they put their goals in the app and learn how to use the daily planner before they enter the real world after treatment. And I think this is one of the crucial parts in really making sure that they have less new thing to learn when they leave the treatment center. And then, of course, it can be your companion when you do your outpatient treatment, as well as when you go, when you graduate from formal treatment. So here you can see the discharge plan that one of our largest partners, this is SRA, is the largest treatment center in Iceland for addiction. And currently they have this piece of paper that I mentioned in the beginning that my cousin left the treatment center with. And we've user tested this with many individuals at the treatment center, and it was really fun to see how they mentioned that, like, wow, why hasn't this been an app before? Like, it's crazy that we don't have this in an app already in 2025. So the patients were really eager to start using this, as these questions are actually really good for patients, and they mentioned to me that this paper, it tends to end up in the trash or get lost. So it asks questions about, like, which strategies are you going to use to reduce and manage your stress, and some of the relapse prevention. So in which situations are you most likely of returning to substance use? And using technology, like, for example, if a user mentions evenings, like, we could potentially send a special encouragement in the evenings. And then having your relapse prevention, so writing down how you're going to handle a situation in the future, and having your plan, that's something that patients really liked the idea of having. So we will be implementing this with SOAU in later this month, and we're actually starting a research study with 80 participants to see if those individuals who get SPAT as a part of treatment have better treatment adherence and better, for example, less anxiety, etc. So we're very excited to see the results. We were so fortunate to have received the first place in the International Society of Addiction Medicine Innovation Award competition this year in Hamburg. And it was a great recognition from the clinical society. And we also received the Icelandic President's Innovation Award for our first prototype back in 21. So there are over 1,700 individuals that have downloaded the app since October last year, but we have not really advertised already. So this is mainly just word by mouth and the individuals or the treatment centers recommending our app to their patients. And just for context, there are only 400,000 people that live in Iceland. So Iceland is rather small. But next year, we are planning on launching a marketing campaign to really drive these numbers up. And we can see that the daily active users is at least 65. There are some people that are not agreeing to letting us track these data, so it's probably higher than that. And then we can see that our 1 month retention is 49%, which is actually really good compared to digital health apps. They are around 3 to 5% typically. So what this means is that individuals open the app at least once for 4 weeks straight. The key reason that we're doing this is to support patients in their recovery journey. And the most fun thing that we do is hear feedback like this one on how our app has a positive impact on their sobriety journey, and that they even feel like our app is their own personal alcohol and substance use counselor, and supports them in tracking their progress. Last year, there was done a review of treatment services for Iceland, and it was really, really good to see how he mentioned specifically how digital relapse prevention tools can greatly enhance the reach of addiction services without greatly increasing the costs. So I feel like we're at a certain stage right now in the world where I think society is realizing that we can use digital tools in many ways, especially for continuum of care and follow-up care to really support. And it has been fun to see also that even though we are working in addiction, we've also caught interest for other clinics that are, for example, working with obesity and such. Because really our daily planner is something that is crucial no matter what disease you have. So we are looking forward to seeing where the future journey takes us. But our future vision is really making sure that everyone receives access to evidence-based recovery support, regardless of time, place, or circumstances. Yeah, that's all from me today. And thank you so much for having me, and let's connect on LinkedIn. And I would love to love to hear your thoughts and what you think about our journey.
Thank you very much, Thordis, and congratulations with your success and the progress you're making. Do you have questions or comments for Thordis? No, everyone quiet. I was just a little bit curious about, because I totally agree with you that the user involvement is so important. But what is the view of or the perspectives of the professionals? Did they come to the development, or was it more on the patients?
Yeah, no, the clinicians have always been a large part of our development as well. And like initially we started interviewing with the professionals before we got access to the patients. And I've had several presentations for the staff at SOA, for example, the largest rehab centers, and it's really fun to see how they're really the ones that are encouraging the users to use it. So they, for example, start each day at the inpatient treatment at week. So that's the 1 month retention, 1 month treatment at opening bate and listening to meditations in bate, for example.
Mm.
So they really are on board on the development. And I think that's also crucial. Like patients, very crucial because they're going to be the end users, but you really need to have the buy-in from the clinicians to really build something that has lasting impact.
But the clinicians are not using it as any kind of a follow-up. It's like a self monitoring thing for the patient after the discharge, right?
Correct, but we've done a prototype that includes an employee portal, so the employees can actually see if, for example, people are staying routine, like are they going to their AA meetings? Because for some individuals, that's really important. So we've started these conversations and also talked about integrating the graduation plan to their electronic health records, because this is quantitative data that's really, like, for example, one of the questions is like, are you going to go to the job market? Like, are you going to go to school? Like, a lot of these informations are actually very good for these treatment centers to have quantitative, not just on a piece of paper that they don't really get the information. So that's also some conversations that we are having right now. So we'll see how that ends up.
Yeah. Great. Any questions? Or anything in the chat? No? Mikael?
Yeah, well, thank you very much for a very nice presentation. It's very interesting. I think also there will be perspectives for Greenland here. Is the app, it's in Icelandic, I think, but can you choose different languages, or is it mainly thought that it should work in Iceland?
So we've actually translated the app to English. We don't have the education material in English yet, and not the meditations, but we have translated the app in English, and we are actually seeking funding right now to go to market, to go to foreign markets next year. So that's definitely on our radar.
Yeah, it was just a thought about, because I mean, addiction is a problem in Greenland as well, especially when it comes to alcohol and smoking. And now you mentioned also obesity. So I think that there's opportunities to think about, at least here.
Definitely. Do you have any potential connections that could sort of open up doors for me?
I do, and probably will have to take a bilateral meeting on that to seek a little bit out what possibilities are.
Yeah,
Awesome.
I can connect you guys.
Yeah, that would be great. Thank you very much.
Awesome. Yeah. Thank you so much.
Great. Any more questions for Thordis? No, thank you very much, Thordis, for your contribution and presentation. It was just as interesting as I heard it the last time. So thank you.
Thank you.
So now I think we changed the focus a little bit and actually reach out to more familiar things to me, since my colleagues, physiotherapists, are here and they're going to tell us about the Euneo project. So Daníel, It's strange to say the floor is yours, but the screen is yours, I should say. So go ahead.
Thank you. Can you see this?
Yeah.
Okay. So thank you so much for inviting me. My name is Daníel Friðriksson, and I am one of the founders of Euneo Health. I have a bachelor's degree in physical therapy from the University of Iceland, and for the past few years, I've been building Euneo together with my father, Fridrik. Fridrik has over 27 years of clinical experience, and having watched him throughout the years really showed me how much impact physical therapy can have on people's lives. And his approach really became the foundation of Euneo. So what's always guided his approach is active treatment and helping patients take ownership of their health and their recovery. So in outpatient care, a therapist typically gets 30 minutes with a patient every 1 or 2 weeks maybe, which means that most of the rehab happens at home, not in the clinic. And we know this, and this is why home exercise prescription has become the standard for keeping patients engaged between appointments. But the problem is that most people simply don't do their home exercises. And every therapist knows this challenge, and every patient relates to it. And we believe it's not because people are simply lazy, it's because they lack structure, support, and consistent follow-up once they leave the clinic. But at the same time, therapists are under growing pressure with high caseloads, wait lists, more documentation, and less time for care and follow-up. They want to provide the best care and support they can, but they can't do everything. So these are universal challenges we're facing across all of healthcare that we all recognize. And one of the most powerful ways to address them is through technology and digital tools. And over the years, there have been many different tools developed for physical therapists to make it easier to deliver home exercise programs to patients. But all of these tools were built mainly for the therapist to prescribe exercises to the patient. But the real problem is not prescribing the exercises, it's actually helping patients engage in their care and do them. And the way these tools are being used is most often we print out exercises on sheets of paper or email them, leaving patients with nothing more than a static handout that just gets lost and forgot. And even when using modern apps, they're definitely better than paper, but they often just feel like digital handouts if they're not combined with consistent follow-up and support from the therapist. So what we see is that the patient motivation fades quickly and they disengage. And what we've actually learned is that patient engagement depends a lot on therapist engagement. So it's a loop between the two that each feeds the other. So when therapists personalize, follow up, and show patients that they care, patients feel more supported and they succeed. But when we just hand patients static exercise handouts and expect them to get them done, and that support and follow-up is not there, patients easily drop off. And the same principle applies for therapists. So we expect them to adopt and use new technology, but that takes them both time and effort. And if they can't see how that effort is impacting patient outcomes, they lose conviction and they disengage from the digital tools. And obviously, when the therapist disengages, the patient loses their support and they disengage as well. So if the loop breaks on either side, both sides fall off and lose connection. And this is what we call the engagement gap. And what we are trying to do is close that. And that's why we built Euneo. It's a connected care platform designed to strengthen the patient-therapist relationship and create a feedback loop that reinforces engagement on both sides. Therapists create or select expert-made exercise programs, which they can then tailor to each patient's needs. The patient then connects through the app where they get clear guidance on how to do the exercises, helps them track them, motivates them, and reminds them to do them. When a patient interacts with the program, that data then flows back to the therapist, giving him clear and actionable insights into the patient's progress. So we both use the data tracking to motivate the patient, but also to give the therapist a more detailed insight into where the patient is, making it easier to personalize care and follow up more effectively. But what really matters the most is the human connection, and that patients, when using the app, feel that their therapist is actively supporting them on the other side, and that therapists can see that their effort and support is having an impact. And this feedback loop between the two helps us reinforce engagement, improve outcomes, and build trust on both sides. We've been developing Euneo for over 3 years now, and with support from the Icelandic Technology Development Fund. We've won the Icelandic Web Awards for design and user experience, and this is really important because clinicians have a very limited time, so what we've really focused on is making everything as simple and intuitive as possible. You need to be able to get your job done as quickly as you can without sacrificing quality. So we focused a lot on design. And we are now integrating the platform with Sjúkraþjálfun Íslands, which is the largest outpatient clinic in Iceland. More than 1,000 patients have been supported through the platform this year. And in a survey of over 300 patients, 92% said that Euneo improved their overall experience of physical therapy, and 82% called the app essential or very important to their recovery. Patients consistently tell us how impactful the app has been for them, and this level of digital support has really become something that patients are now expecting as part of modern care. People are tired of getting a paper sheet with them home. But we've also been working with therapists in remote areas across Iceland. And in these regions, one therapist might need to serve an entire community. So they can't specialize or refer easily, and they need tools that help them treat a wide range of cases confidently and efficiently. And in these cases, Euneo has actually been able to help them by giving them expert-built programs that they can trust, making them more confident, and by helping them support and monitor patients remotely. So we actually have heard from them that they've been able to reduce unnecessary in-person visits without sacrificing quality, because they're more confident in using the technology to support people remotely. And people often need to travel for hours to get to the clinic, so saving just one in-person visit is a lot of efficiency for everyone. To sum it up, home exercises don't work if patients don't do them, and digital tools don't work if we don't use them. And we believe the future of physical therapy and healthcare in general needs to be hybrid, that we need to use technology to strengthen the human side of care, not replace it. And we need to empower patients to take an active role in their recovery while extending the impact of the healthcare professionals we have beyond the clinic. Thank you.
Yes, thank you very much, Daníel. This was very interesting. Do you have questions for? I had one. What does Euneo mean? Just like, where does the name come from?
It's a combination of two Greek words. It's eu, which means good, and neo, which means new.
So new you, yeah, new you.
Good new.
Good new, yeah. So do you have questions for Daníel? Mikael?
Yeah, thank you again, Daníel, for a great and understanding presentation. I think I understood that it was made individual, the training, but do you have some also like group-based scenarios, or don't you think group-based scenarios are a good thing in concerning physiotherapy?
I'm not sure I understand.
Yeah, it was just that I could see that it was individualized, but the effect of being in a group when you exercise, that's also some effect that you have to. Also, if you're training, I mean, without an app and things like that, okay, you have an appointment with, we are running today. I know it's raining, so if it's just me who was going to run, I wouldn't go running, but I have an appointment with my neighbor or my friend or somebody, then it's just because in Greenland we use, but it was not it was in another way, but we used it like this group supervised home training. But it's I know it's a different concept, but I just thought if there was any ideas in grouping people also.
Yeah, that's a great idea, because I think it has a lot of impact to, the social aspect of it and having that community around it. But right now the app is mainly thought of as like a personal treatment for each patient.
Yeah.
But it's definitely something we can like look at and have thought of to like try to create some kind of community to help patients stay motivated.
But a great initiative.
Thank you. I was thinking about I'm always thinking about the professionals, and I agree so much to you guys that we kind of need to change how we serve people with our physiotherapy services. And you have asked patients, which seem to be very positive and like the app. But what about the physiotherapists? Well, I guess those who are actually using it, like using it. But how can we kind of encourage other physios to use such kind of a tool? What do they need?
So it's definitely hard because people are really like habit-based. They've been just handing out the sheets of paper for 10 years or 20 years and doing the same exact thing. And there's not really any urgent need that they feel to make a change. Because they just have a constant caseload, and there's not really any incentive for the therapist to increase his efficiency. And if you look at it at like a systematic level, I think that's one of the main things that we would need to change, is to create an incentive for the therapist to use the tools, because we can't just expect everyone to go out of their way and take time and effort to do the extra work of learning how to use them, because we're not reimbursing or paying them to actually follow up remotely or with the digital tools today. So it feels like unpaid extra work to them. And there are countries that are starting to reimburse remote follow-up and care more consistently. So I think that's one of the main things that we would need to change, is the therapist needs to be incentivized to increase the efficiency of how he delivers care and follows up. But also we need to teach how to use the tools effectively in school, and that needs to be continued on into the clinic. But it's definitely hard getting therapists that have been practicing for many decades to change what they're doing, and that's something we are just battling every day, trying to get them to change.
Yeah, I guess we are nothing but habits all the time wherever we are.
Yeah.
Okay, do you have any more questions for Daníel or his father? No? Okay. So I just thank you very much for your presentation, and we will definitely be in touch at some other time, since I work at the university. So you might want to teach the future physiotherapists the importance of this. So, but thank you very much, guys. And then we have the last presentation, which is bringing us to Greenland via Denmark, I guess, since Mikael is located in Denmark, right? Right now.
Oh, I'm located in Denmark right now.
Yeah.
Daníel, your last comment that it's very difficult to change the work habits. I think that's very essential for what I'm going to talk about. Stein, thank you very much, first of all, to include me in this very interesting seminar on different kind of telehealth. I find that very interesting. And then to all of you, I just apologize that my voice is not so good, and I hope it will keep on for 15 minutes. I am struggling with some flu-like symptoms, and it's pretty aggressive in my throat, I think. So my title today is Video Tele and Mail Telemedicine Consultation at the Steno Diabetes Center in Greenland. I performed this study together with a medical student. It was her master thesis, performed at Aarhus University. So now I just a few words about myself. I'm a physician. I'm a general practitioner and a researcher, and I have lived in Nuuk, Greenland for 25 years, which is almost half of my life. I speak Greenlandic and Danish, and as you can hear, some English as well. I have been running different kind of programs in Greenland concerning diabetes, which was then extended to a larger program concerning also hypertension and chronic obstructive lung disease. And then in 2020, I was employed as a chief medical director of the Steno Diabetes Center, which was then launched at that time. And the Steno Diabetes Center in Greenland is focusing, of course, on diabetes, but we also have the other conditions that we have been worked on, which is hypertension and chronic obstructive lung disease. That means we have almost a fifth of the Greenlandic population as people that we potentially could have contacts with in our clinic. I want to start with the conclusion here that we use telemedicine widely at Steno Diabetes Center in Greenland. It's like in 2024, 70% of all consultations was telemedicine consultations. In the study period, which I'll come back to, from 2001 to 2024, the number of telemedicine consultations increased. And especially from 2003 to 2024, we had a steep increase, which indicate that we have not reached the full potential for telemedicine in Greenland, not at all actually. to my experience, to my opinion. As everybody here probably is aware, that telemedicine can be defined as delivering some kind of healthcare service over a distance using some kinds of technology. And just to put it in a little bit into groups, we can group it as provider-to-provider telemedicine, but you have the contact between two professionals, and the client-to-provider, where it's a client direct to the healthcare professionals. In Greenland, we have used a lot of provider-to-provider telemedicine for many years. It's all kinds of communication and sending pictures and live videos, examinations, I think. So we have used a lot of that. But the client-to-provider telemedicine has been restricted to telephone use and with the local physicians. I will come back to that with the local physicians, because in Greenland have a lot of isolated clinics. And only in Nuuk, which is the biggest town in Greenland, actually there has been mail consultations also for a long time, but it has never been extended to the rest of the country. Telemedicine can also be like synchronously, like live contact, but it can also be, as the two former examples here, it could be asynchronously. That means that the patients or a healthcare provider delivers some data. It would like store and forward data, and then you can reply later on these if you are healthcare professionals. Well, obviously, there's a lot of good things about telemedicine, but one of the main things, and the thing that I will drive on here, is that telemedicine can improve healthcare availability for populations with limited access to healthcare service. And especially in Greenland, this is an important thing. At that time called Home Rule Government of Greenland, they took over the responsibility for the healthcare system from Denmark in 1992. And in the legislation there, it was mentioned that there should be high quality healthcare to everybody, regardless of place of residence. And I'll come back to that, because that's an issue in Greenland, because we have such a great country. And if I focus on the little part of the healthcare system, which is called Steno Diabetes Center, we have high quality of care for all patients with diabetes, hypertension, and chronic obstructive lung disease. And of course, again, regardless of their resistance. And the Steno Diabetes Center is placed in Nuuk. And as you can see on this, only a third of the population lives in Nuuk. While the rest of the towns here in Greenland, 17 towns altogether, they are isolated from each other. There's no route connecting them. So you have to go by plane or boat. And it's also very expensive to go between these places. And weather conditions also limit the transportation availability sometimes, quite often actually. Even from Denmark to Nuuk, we don't have we have some issues on regularity. As you can see, also the healthcare, we do have healthcare centers in all these cities, but in addition to these cities, we have like 60 minor settlements as well, where we also have one healthcare professionals employed. Probably I shouldn't say professionals, maybe, because like they don't have an education. But they are paid for it. So, but most of them, they don't have an education, and most of them are primarily Greenlandic speaking, in contrast to a lot of the healthcare workers, which are primarily Danish speaking. Well, with the launch of Steno Diabetes Center, that was one thing, but beside of that, we got a donation from the Novo Nordisk Foundation to do a new initiative on telemedicine in Greenland. And based on prior experiences, we focused on developing an initiative with 3 core elements. And the first element was to have an app, so we could do video consultations with patients on their own app, on their own device, so to speak. Because we had done telemedicine and video consultations before, but that was on Teams. And then you had to have the provider, the healthcare provider in both ends often, and you had to have 2 rooms often, and sometimes also an interpreter, very often an interpreter in one of the rooms, and also the client also. So all these 7 entities, to combine them and have them to happen at the same time, very often failed. Like 70% of the consultations were actually missed because one of either the room, the patient, the interpreter, or one of the healthcare professionals. So it was very, very difficult. So based on that, we wanted to make it simple. And it was also based on the fact that a lot of people in Greenland have their own mobile phone. Even the older people, they have a mobile phone, and they are all on Facebook, never depending on their age. So that was one important thing for us to do. The second important tool was to standardize some standalone materials that could be point of care devices, so that we have the same device all over in Greenland, and both in the towns, in the clinics, and also in the settlements. And of course, they don't have all the devices in the settlements. They have the most important in the settlements, and then in the greater the hospital, the more devices you have, of course. And what was important about this standalone, it was also because we earlier had an experience with setting up actually a very huge and complicated and very large instrument in all the settlements. It was done in 2008, and it was retried to do that in 2012. It's called Bibaluk, and it was a system with a lot of instruments on. But as you can imagine, people without an education, it can be difficult to handle all these instruments. And the second problem with that was, there was a lot of problems with this, but another problem was that if there was any problem with it, if one device was not working, it was like, it's not working, all of it, so we don't use it. So it was not used. Only very few settlements and ended up using this system. Also, I have other. It was American systems, so the delivery problems, and yeah, I can mention a lot of problems. So my idea about this project was let it be very simple, and we can promise you that in these settlements there will never be any kind of technical support. So if the device is broken, we can send a new device. So that was the idea about this standalone point of care devices. And of course, all of them were tested very much. Are they very simple? Do they have very few buttons, and etc., etc.? And then we have the shared platform as an important thing, because also the former telemedicine issues, it was like a separate system, like a parallel system to our medical record. So we have that. One of the problems in Greenland is also recruiting, but especially retention of healthcare professionals. So if they have to learn a lot of systems and find out, even a lot of people that have worked for Greenland for many years, they didn't knew that there was this parallel system that we could actually also use. So we wanted to integrate it, because we have one huge advantage in Greenland, and that is that we have a common healthcare system. Never mind if you are in the primary clinic, in the by the dentist, or in the secondary service, we are in the same. We share the same data, so we have complete shared data for every person in Greenland. That means if a patient are seen in a settlement even, and they take the blood pressure and record it, then at the same moment I can, from a large distance, look at this data. So shared platform. So that was a main strategy to do that. And a fourth thing that came on a little bit earlier was that the Dr. GL, this mail platform that have been used for and been very popular in Nuuk for several years, more than 20 years actually. We also wanted to do that in Steven Diabetes Center to do that in all country, so patients could actually contact us and send in blood pressures and other kind of communication. So the implementation process, of course, it started off with a lot of workshops, and I gave you some points of what came in, that we need the same devices, simple devices and standalone devices, video and everything. So that was the workshops. And then we made, of course, guidelines. We held online physical and physical education. That means that we on Teams educated the healthcare professionals and the healthcare workers in all the hospitals, but also in the settlements, different kind of education in Greenlandic or in Danish, and then we had some regional courses where we like people from the settlements came in one region and were treated, and then finally in 2024 we held a national course for all the people from the settlement, so they could also meet each other, because they are very isolated. They are in their very own settlement, long from everybody, and they share a lot of the same problems. So also to bring them together was important. And then we monitored the implementation and followed up where we could see that there was problem with they are not using it so much. We followed up with the clinicians. How can you work with it, and also with the technicals, because some technical problems arise, of course, underway. And then we had some specific milestone, and that was partly because we were funded by Novo Nordisk, so you had to be very upfront with data that you say that this is a goal, we should aim this before the money are released. Then okay, you should at least achieve these data. So and then maybe an interesting thing also about this, because I noticed that they have not the Batty app, that was not promoted so much from the beginning, and we also used exactly the same strategy. We want to test it before, and we had a lot of conversations before we, at least not before in 2025, actually came and made TV screens and everything on it, because we want to test that it was good before we were doing the advertisement for it. So the aim of this, it was a little long introduction, but the rest of it will be more shortly. But what you say, Daníel, to implement telemedicine can be really cumbersome. It's taken a long time to physicians and other healthcare professionals to change their mind and to see that it's actually as good, and in a lot of cases better than more effective in many ways. So we want to see how would it actually go with implementing the strategy. We were following the data, and we did that on cross-sectional study. We took out data from our electronic medical records in the period, just to see how we were performing during the implementation process. The kind of all our consultations, they are divided, they are noted. Is it a face-to-face consultation? Is it a telephone? Is it a mail? Is it a video? Or is it an administrative contact? The administrative contacts, that can be just that you make a plan for a patient, but it can also be a medical assistant request, like one of our colleagues from the town outside Nuuk. They have problems with patients with diabetes, for instance, or hypertension or anything. And then they send the data to us within the healthcare system. and promote us, ask us, could you make a plan for this patient, or could you see this patient, or whatever they kind of need. And we will always make like an administrative contact on that. So it's mainly also telemedicine. So among the 5 different kind of consultation type you have, 4 of them can be categorized as some kind of telemedicine.
Mikael, I'm sorry, the
Yeah.
time is flying, so maybe you can
Okay.
speed up a little bit. Sorry.
I speed up. Yeah, I can see it's running. The number of consultation increased in the period from 2001 to 2024, and that was because we had more employees. Then you can see that telemedicine declined from 2001 to 2022. And this decline can be explained by the COVID epidemic, which came late to Greenland because we closed the country. So we use a lot of telemedicine in 2001. Then when we look at the email consultations, you can see they started in 2022, but then a rapid increase after people understood that they could actually write to us. And especially the video consultation in 2024, we had a huge increase that when the technical problem was solved and we rolled it up, then we had a lot of it. And I can tell you that the data from this year is showing that we are still on the increase. And also the atmosphere, we have a lot of contacts with patients from outside now. This is actually a figure that's just show the same, that 70% of the consultations now are telemedicine based. These data are the medical assistant request. You can see that we have a lot of requests, and also this year we are on the increase compared to 2024. So in conclusion, we use a lot of telemedicine now in Greenland, but we are not using it enough still. And it is in accordance with what we just had a Greenland Health Commission that emphasized every organization within the healthcare system in Greenland to work on telemedicine. So that will be the final word.
Yeah, thank you very much, Mikael. I think it's so interesting because it's such a challenging environment that you have in Greenland. So, but is there like one question for Mikael? No, everyone is quiet.
They're quiet. That's okay. And this is just one of the things I talked only about the quantity, but of course we also, as you know, Steiner, because you were there, of course we have looked at quality data as well on this and are following up on the implementation still.
Yeah.
And we expect and hope that the rest of the healthcare system will follow up on this. So it will not only be this big but restricted patient group that are having the benefits of it.
Yeah, maybe because our group is focusing on both health and social services. So is there any social services that are being delivered in like teleservices in Greenland?
Thank you very much for this question. Excellent questions. Actually, on this Buisa app, we had one. It is actually an app that can be used at every institutions in Greenland. They can go on it, but at the moment it's the social department of social affairs. They have actually included on this, so because they have they have therapy from psychologists, and they use the same platform. So it's my wish that in Greenland, the other institutions like tax and everybody, people that could need to use it, could use this platform. And to me, it's not important that this will be the Buisa platform, but just one platform. If we could use the same platform, that would be excellent. Also for private, actually also for private people, private companies, psychologists, physiotherapists, etc.
Yeah, exactly. And it's much easier for the user actually to have it all in one app rather than having these different platforms. Yeah. Okay.
Yeah.
Well, I think our time is running up now, or actually we are out of time. So I want to thank you all, Mikael, Daníel, Fridrik and Thordis, if you're still there. And I'm sure that if there are any questions that will arise later, we might contact all or any of you at some point. But thank you all very much for your contributions and all the participants in the webinar.
Thanks again.
Thank you,
for
and have a
Thank
good
you.
day.
Bye.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Bye.
Bye-bye.